Remember when health leaders said you couldn't mix and match vaccines? Well, a new study shows that it could be okay in the future. Brittany Moncrief has more.
New data alert, and
the data sounds promising.
That's coming from Methodist Dr. Morgan Jones. So, you know, when vaccines first received emergency use authorization, health officials said no mixing allowed. Well, a new National Institute of Health study is showing some pretty hopeful data when it comes to mixing vaccine booster shots.
The interesting thing about this study is it's only about 450 patients, and they gave 9 different combinations of vaccines.
One combination that stood out was the Johnson & Johnson vaccine.
When they boosted a Johnson & Johnson patient with another Johnson & Johnson, their levels of immunity in their body rose by 5 times what they were at baseline.
That's not the kicker.
When they boosted a Johnson & Johnson patient with an mRNA-based vaccine, Moderna or Pfizer, those levels went significantly higher.
30 times higher.
It sounds good, but we don't necessarily know that you need that level of antibodies in your body to fight COVID. What we know, or what we think happens, is that you almost trick the body into inducing a more large immune response.
Which it did, but
just because the body produces a larger immune response doesn't necessarily mean that that changes the way that it prevents COVID infections.
They're all still effective in preventing COVID hospitalizations and deaths. Now, you may wonder, why couldn't we mix before?
We didn't know the safety profile of mixing and matching these vaccines.
So until more research is done,
we should stick to getting a booster dose of the original vaccine that we got, because that's what's approved by the FDA.
And right now, only the Pfizer vaccine has been approved for boosters, and that's for those of a certain age group, those who are high risk or have underlying health conditions. In Germantown, I'm Brittany Moncrief reporting.